We want to welcome everybody. I want to introduce Dr. Bill Virtue, who is on the board of directors, and he's going to be talking about vitamin D3 today. Let me tell you a little bit about him. He graduated in 1979 from Indiana University. He's participated and joined many different organizations, such as being the past president of the Blue Ridge Dental Association, past president of the Forum for Dental Aesthetics, alumni of the Pankey Institute through Level 6, advanced training at LVL, through chairman of the IAOMT Clinical Practice Committee and the Mentor Committee. Teaches the fundamentals of biological dentistry at the IAOMT and a member of the American Academy of General Dentistry. He also now enjoys skiing and living in South Mountain Lake in Southwest Virginia with his wife Bobby. He's currently administrative VP of the IAOMT. I just want to put in a little side here why we have you here. If anybody feels that they need help in any aspect of mentoring, you feel that you got it mostly, but you still need some help, we do have a one-on-one mentoring program. You can either see me or Kim. I'm in charge of the mentoring program now, and we want to coordinate it to help you guys out. In the meantime, I introduce Bill Virtue. Thank you.
Thank you, Mark. Thanks, everybody, for being here. Okay, I got to read this, don't I? Okay, I'm not selling any vitamin D. AGD disclaimer. I do not have any financial interest of a product in my talk or with any companies offering grant monies for this continuing dental program and medical education. All right, well, thank you for being here. What I'm going to talk about today is vitamin D. Why? Is because in the last year it's become very popular. We've heard more patients coming in that have had their vitamin D checked. When we hear about it, there's more news releases about it. And why now is because we're starting to understand and appreciate some of the health implications of vitamin D. In the past, we've looked at vitamin D as strong bones and strong teeth. But there's a lot more that it does, and there's a lot more that we don't know that it does. So I'm not going to have all the answers today. I'm not here to be an expert on vitamin D. I just found it an interesting topic, and I used this as part of my thesis for my naturopathic degree with Bob Harris and Phil Monica at the, can't remember the Academy of, I'm about to look that one back up. But at any rate, I'll get back with that. But at any rate, let me get the pointer here. Don't make a living doing this. I make a living doing dentistry in a small town of Yadkinville, North Carolina. And it's a little bit west of Winston-Salem, small community, but we seem to do okay. So this may be the most unknown and unappreciated vitamin, and it's actually not even a vitamin, it's a hormone. But there's over 1 billion people that are reportedly with lack of vitamin D or low levels. Harvard University suggests that 70% of white, 90% of Hispanics, and 97% of blacks are deficient in vitamin D. The older you are, the less vitamin D your skin makes. 3 out of 4 Americans are reportedly deficient. Obesity lowers the amount of vitamin D. The darker your skin is, the harder it is to make vitamin D. So the benefits of it are manyfold, and we don't know all of them yet. As you can see, there's heart disease, cancer, stroke, infectious disease, dementia, depression, insomnia. It increases serotonin. One of the reasons we feel so euphoric, people like to lay in the sun, muscle weakness, joint pain, fibromyalgia, osteoporosis, psoriasis, multiple sclerosis, and hypertension. The list probably goes on and on and on. We don't know everything that it does or helps with. And what I'll also do is kind of explain a healthy regimen with the sun. Now, I don't claim to be an expert on sun exposure, but we do know that the best way to get vitamin D is from sun exposure. It lasts 2 to 3 times longer than supplements do with the levels of vitamin D. And it became apparent to me, I have a house at Smith Mountain Lake in Virginia, and some of our friends, when we go up there and they go out in the boat, they're completely covered. They got a hat on, long sleeves and pants, and it's like, why are people so afraid of the sun? It seems almost natural to me, since we're not covered in hair, that we ought to be able to go into the sun and not catch melanoma or everything else we're afraid of. So I'm going to talk a little bit about that too. But this is a condensed talk of something that's about 3 hours long. So I put some things in here. I don't have everything, but hopefully it'll be interesting. What we do know is people living in sunny climates have a lower incidence of organ and cell-related diseases. Vitamin D is unappreciated and misunderstood, one of the misunderstood anti-aging secrets. Now, I will explain sensible sun exposure, adequate calcium intake, and supplementing with vitamin D. Now, going back with history, we all heard that the dinosaurs were extinct from a comet or a meteorite or something that hit the Earth. Now, one of the theories is anyway. But the other theory that goes along with that is that because of the dust cloud caused from that, there was a lack of sunlight that got to the sun. That's pretty well, from the sun to the Earth, pretty well accepted. But because of the lack of sun, it's reported that maybe dinosaurs lacked vitamin D. Therefore, the eggshells from the dinosaurs were crushed, and the dinosaur eggs didn't hatch or develop. And that was one theory. Neanderthals, as they migrated across Europe and they went up to northern Europe, are now thought to have had fair skin and red hair. And the fair skin, obviously, is designed so that they could make more vitamin D. The darker in Mesopotamia, that area, we had darker skin with much more sunlight. Oh, excuse me, backwards here. We've heard reports for years about rickets back in the 17th century, which is about when rickets and the vitamin D connection was made, actually in the 18th century. And in that time, England, London, everything was coal-fired. So if you had a heater in your house, it was coal-fired. Everybody burned coal in the wintertime. And Great Britain also has a very cloudy winter. So the children came up with a lot of different disorders, and you can see bowed legs, misshapen pelvis, enlarged head. We don't see rickets much anymore because we do have some vitamin D. But they discovered that the kids that lived on the coastline who had more of a fish diet, particularly even in Norway, Scandinavia countries, didn't develop rickets. But the children who lived inland did because of lack of sunlight, and again in London because of the unhealthy environment. Again, tall buildings, coal furnaces, and kids in the city, and then those on the coast did not develop it. In the 1950s, I'm 59, so I can remember the 50s a little bit. We noticed that everything got fortified with vitamin D. In fact, even Schlitz beer was fortified with vitamin D, along with bread. I mean, Wonder Bread was fortified with D, and a number of products were, because we were starting to understand the importance of it, but still the dosage was way low. Even orange juice. And the orange juice today is still fortified with vitamin D. You can buy it. It's not all, but you can buy it that way. Gentleman asked me earlier about early childhood exposure. It's reported that if you, from time of birth to age 15, are living in a sunny climate, you're more than 2 times as likely not to develop diabetes type 2 or MS. Now, that doesn't mean that sunlight doesn't help you later on in life, but it's very important to get it early on in life. And again, I'll talk a little bit later about the latitude 35 degrees from Atlanta to Los Angeles. The difference between a hormone and a vitamin is that a vitamin is consumed and a hormone is made inside the body. So when we talk about vitamin D, it's really a misnomer because the vitamin D we're talking about is made in the skin. So if you make it in the body, it's not a vitamin, it's a hormone, even though you can supplement with it. The term vitamin comes from the Latin term vital amine, which is a substance essential for health but cannot be made in the body. It's obtained through the diet, supplementation. Vitamins are vital to growth, development, and metabolic reactions. Hormones, on the other hand, are synthesized in the body from simple precursors and go to distant areas in the body, different tissues. We got some more folks coming in. All cells have vitamin D receptors. It was originally thought years ago that the kidney was the only area that had a vitamin D receptor, and what the kidney would do would then send vitamin D to the intestine, which we've now discovered, and was responsible for the calcium metabolism in bones and teeth. But we now know that we think all cells have vitamin D receptors. Now, sources of vitamin D come from very few foods, Oily fish is one, and we talked about that a little bit in the lecture, Dr. Cott, and mushrooms, unsurprisingly. But that's the only foods that comes naturally with vitamin D. So that goes back to the idea the kids on the coast in Great Britain and Norway, Scandinavia, don't develop vitamin D or rickets problems because the oily fish. So the cold water fishes have a lot more vitamin D in them, and along with mushrooms. Now, sunlight, as I mentioned before, it lasts twice as long, the vitamin D twice as long as what you get with supplementations. And then the fourth way of getting vitamin D is the supplement. Until the 1990s, it was believed the kidneys were the only area in the body that were responsible for activated vitamin D. And there's a difference between activated and inactivated, and I'll talk about that. Kidneys make this supply with 25 vitamin D, which is made in the skin, or excuse me, made in the liver, and put in the bloodstream and created by the liver, and then that is made in the skin. So it goes from the skin to the liver, and then it goes into the cells and or the kidney to be activated. The supply of activated vitamin D that the kidneys actually manufactures is very small, and it stays the same. So even if you don't have much vitamin D in your body circulating in the blood, the kidneys will still make enough activated vitamin D to take care of bone metabolism. Now, baby boomers, this is an interesting story because me being a baby boomer, maybe somebody else in here, can remember when the girls would sit out with, oil and sit in the sun, and they'd have magnifiers on them and really fry themselves. Well, we used to have sunblocks, which we knew about, but the thing about the sunblock is they only protected against the vitamin B rays, or excuse me, not vitamin B, the UVB rays. Now, the UVB rays are responsible for vitamin D production and sunburn. So the UVA rays are responsible for the wrinkling, melanoma, and the different kinds of skin cancers. So what we were doing essentially is protecting ourselves from vitamin D, but not protecting ourselves from sun damage. Today, sunblocks have UVA and UVB protection, so we're a lot better off with that. But I think that's what gets back to the generation now that thinks you should shy away from the sun entirely, is because of the fear of the UVA damage. So I'll talk about that a little bit better later, how to get better coverage with the sun. And so again, UVA, what we weren't protected from. What can affect the volume of vitamin D you can get is the time of day, the time of the year, the latitude, altitude, weather conditions, reflection, and pollution. If you want to get the maximum amount of sunlight, it would be between 10 and 2 in the day. The time of year, a gentleman was asking me from Connecticut, you're not going to make vitamin D in the winter in New Hampshire or Connecticut. You'd have to supplement. But the reason that the way we're supposed to do this is from natural sunlight, that the fat cells would store that vitamin D and would last through the winter. There's also been reports that there's more flu, influenza, and different type of contagious diseases in the wintertime because people's vitamin D is depleted and they don't have the power, the immune system power, to ward infections off. So, and the fact that we're keeping ourselves out of the sun, at the same time not supplementing, is the reason we have low vitamin D now. Latitude, I'll talk about that a little bit. The further south you go towards the equator, the more vitamin D you're going to be able to make from the sun in less time. So the people at the equator have much less incidence of multiple sclerosis than people at a higher altitude. Again, that's kind of dependent on age. If you grew up at a lower altitude, up to 15 years old, you have much more protection. It's estimated that 50 to 70,000 Americans die each year with inadequate amounts of vitamin D. There's 9 to 10,000 people die from skin cancers, which is a 6-to-1 ratio. So there's more people die from a lack of vitamin D that are dying from skin-related disorders, cancers. Osteoporosis is preventable with adequate levels of vitamin D. Mostly women have osteoporosis because men have testosterone, or a high level anyway, and we build more muscle mass or more bone mass. So we're more protected than women are. And activated vitamin D is produced by cells osteoporosis, what did I do, change that again? I keep bumping this thing. Activated vitamin D is produced by cells, controls 25,000 genes in the body, which is quite a bit, that control insulin, renin, and etc. Once used, it's deactivated in the cells by 25 vitamin D 24 hydroxylase. In other words, the receptors inside the cell activate the vitamin D, but once it's used, instead of going back into the bloodstream and increasing the levels of vitamin D, it's deactivated in the cell. So we don't have to worry about overexposing ourselves or having too high a level or toxic level of vitamin D. The benefits, again, I mentioned earlier, increases serotonin. That's why we get this euphoric effect when you're laying in the sun. Fights cancer, particularly prostate, breast, and colon. Turns on genes that control cell growth. Prevents blood vessels from forming in tumors. Increases bone density. And lowers levels of multiple sclerosis. Tumors produce a protein called SNAIL that binds to cells, to the cell vitamin D receptors, and then that cell loses its vitamin D protection, and then they don't stick together anymore. So it's a combination of vitamin D and calcium that holds our cells together. Without the vitamin D, without the calcium, these cells can metastasize and travel through the body. Activated vitamin D from the kidneys goes to the bone and into the intestinal cells and helps regulate calcium. And you must have calcium every day. We'll go through that too. So vitamin D without calcium is not very effective. This is a little schematic that just shows from sunlight into the skin, we're going to produce free vitamin D. That goes in the bloodstream to the liver. The liver then produces 25 vitamin D, and that goes to the kidneys and into the blood, and then it is activated. The activated vitamin D in the kidneys is responsible for bone metabolism, and the rest of it into the blood is going to the whole entire body, prostate gland, breast, and parathyroid. And these, again, the sources would be sunlight, oily fish, or supplementation. Lack of vitamin D is related to both insulin-resistant and impaired pancreatic beta cells. Beta cells lose their capacity to secrete insulin when their vitamin D receptors aren't functioning. Researchers at UCLA examined a sampling of 3,000 blacks and white adults aged 18 to 30 and for 4 metropolitan areas. And what was found that among overweight adults, the more milk they drank, the lower their rate of diabetes was. And it was assumed that it's due to the calcium in the vitamin D and the vitamin D in the milk. So that combination helped them become more resistant to diabetes. So milk consumption is good in that sense, but you can also supplement. One study published in 2006 by Diabetes Care that looked at middle-aged women concluded that a high daily intake of vitamin D greater than 800 IUs, calcium greater than 1,200 milligrams, was associated with 33% lower rate of type 2 diabetes. Because immune cells have vitamin D receptors, they may benefit from the vitamin D that the body generates from the sun exposure. After all, why would these cells have receptors for vitamin D if they weren't a purpose for them to be? Well, we're 5 times more likely to have multiple sclerosis to occur if you live in the U.S. or in Europe, above the equator, obviously. So if you're at the equator, you have 5 times less likely chance of developing multiple sclerosis. I think the highest rate in the world is Norway, either Norway or Finland, because of their lack of blood or sunshine if they're inland, if they're not eating fish. And it's believed that early exposure to sunlight increases high levels of vitamin D, helping the thymus gland to kill the cells that later attack the nervous system and increase our chances of multiple sclerosis. Here's a little map you can see that runs from Atlanta to Los Angeles, and that is below that level you have an increased level or chance of having MS. Above or below it you have a decreased chance. Above that you have a much greater increase. And you can see on the bottom there you have 58 to 78 cases per 100,000 people. So quite a significant difference. So the further south you go, the better protected you're going to be. Psoriasis is also helped by vitamin D, and what they're using here is a cream called Vitrol that's used to treat psoriasis. Psoriasis is a situation where the skin is turning over too quickly, and in fact turns over as little as 4 days compared to the normal of 28. So what the vitamin D does is holds the cell together and decreases the amount of turnover of those cells, which decreases the amount of flaking and skin irritation. The only test for vitamin D status cannot use your blood level of activated vitamin D. As I said earlier, the body is going to make activated vitamin D from the smallest amount of activated vitamin D from the small amount of vitamin D in the blood, but that's not enough for the rest of the tissues. So to test for this, they must test for 25 vitamin D, which is what comes out of the liver. So that's the active ingredient that needs to be tested for. And physicians now know this. Many patients come in, and I always ask women particularly if they've had their vitamin D tested. Now, in the last 6 months, I think about, 3 out of 4 older women would say, yes, my physician just did that. But 6 months or a year ago, nobody was talking about this. I didn't hear anybody coming in getting their vitamin D checked. For some reason now, it's become more important. And what I'm going to tie this into later is some dental implications. Now, it's been reported that vitamin D helps with gum disease, and we know it makes strong teeth. But there's also things that I'm seeing more often, the lesions in people's mouths from these bisphosphonate drugs. So it's interesting, and I'll show you some of these later. Very difficult to treat, and we're starting to use ozone on these, seeing what they do, along with cavitations. But Dr. Phil and Malika and Bob Harris have a protocol that we're using to inject in and around the lesions with ozone, and also do blocks with ozone. And you do this 6 or 8, 10 times, and I haven't seen the improvement that they're reporting right now, because I'm kind of new to this, but it's really an interesting thing, because the oral surgeons can't do anything with these lesions. I mean, they come back and they can't cut on them, they can't take the bone out of there. The more they do, the worse it becomes, because the bisphosphonate lesions stop the osteoclastic activity, and the bone doesn't die, it just keeps growing, and at the same time it decreases the amount of blood supply to the bone. So what those drugs are doing is actually making brittle bone to replace which could be healthy bone. So I'll talk about that a little bit later too. Vitamin D is made in your skin, is vitamin D3. You can also supplement with vitamin D2, which is good for vegetarians or vegans who don't want to use an animal byproduct. Vitamin D2 is also transformed into vitamin 3 in the body. And again, I said the test for vitamin D is 25-hydroxy vitamin D, which is not activated, but it's what's flowing in the blood that's come out of the liver. This is a graph that shows where you should be. You want to have 30 to 100 nanograms per milliliter. Most people, I think this works. No, most people are much deficient, and when tested are way down in this area, 21 or lower. You don't want to be over this line, but somewhere right in here, and you'll get a report back that will show you where you want to be. But that's a healthy kind of place to be with vitamin D. Calcium, you can see with the children, adults. You can see this, again, this will probably change. Right now, this is what they're recommending, but I don't know what it'll be in a year from now. Even with the vitamin D levels, it used to be 400 units a day. Now they're suggesting between 5 and 10,000. Physicians are injecting people with 50,000 units a week to get their vitamin D levels up, and they'll do that for a month at a time and then recalibrate and see where they are. I know what I'm doing. I'm bumping that with my finger. I just figured that out. 4 hours yesterday, and I just got it. And why the widespread levels of vitamin D? Well, again, fear of the sun, lack of supplements, and really an unappreciation for what vitamin D does. Until we recently, like I said, in the last 6 months or a year, we had no reason to even think about vitamin D or why we should increase the levels. Now, melanoma is the big scare with sun exposure. Again, I'm not a dermatologist, I'm a dentist, but if a lot of times these melanomas will occur in an area of the body that doesn't get sun exposure. It could be on the bottom of the foot, could be on the side over here, it could be in the hair, it could be in the ear, but they're not always where you get all this sun exposure. And there's 8,600 deaths a year in the United States for melanoma. That's not insignificant. That's certainly serious. If you have a melanoma, that's not a good thing to have, and we all know they're bad actors. But no one dies from basal cell carcinomas. And very few people die from squamous cell, 1,200 people a year in the United States. Again, if you're one of those, that's not good. But that's not a reason to avoid the sun. And melanoma, again, kills 8,600 people a year in the United States. Now, squamous cell occurs on areas of the epidermis that are most exposed to sunlight. And we've maybe some of us in here, I know I have had 1 or 2 of those removed from sun exposure. Again, because we as children, we'd go out and burn ourselves to death. We wouldn't put any kind of sunscreen on. And that's not what I'm suggesting. You don't want to burn. That's not ever good for anybody. But what you can do, And then people in the tropics are more protected from these skin lesions because they're constantly exposed to sunlight. They become accustomed to it, and their skin tans. When you go out in the spring and you get burnt, that's not a good thing. I'm not proposing that. But what you want to do is have sensible sun exposure. And I'll go through sensible sun exposure in a bit. But what you want to do is have a tan. Tans aren't a bad thing if done properly, but burning is not good. Both types of non-melanoma skin cancer are thought to be caused by long-term exposure to sunshine, unprotected. And researchers are looking at a gene called P53. It's a quality control gene that's responsible for fixing a damaged cell or causing it to kill itself. We get one from our parents, one from mom, one from dad. And what happens if one P53 gene is damaged, then we get actinic keratosis, which maybe some of us have had. There's scaly patches on the skin. They're called precancers. You can scrape on them and you get a little white tissue off of there. If you get enough damage later that you kill the other P53 gene, then you can go into squamous cell or a more serious type of cancer. But these genes are designed to protect us, but when damaged, they can lead into a more serious condition. Melanoma accounts for 5% of all skin cancers, killing about, again, 8,600 people. That's 5% of skin cancers are melanoma. Again, that's not a good thing to have one, but it's not particularly a reason to stay out of the sun. And again, it's important, the risk of getting melanoma is about 1 in 50 for whites, 1 in 1,000 for blacks, and 1 in 200 for Hispanics. Interesting thing about white versus black people is we all have the same melanocytes, but some of us are more active, producing more melanin, but there's the same amount in general through the population. And melanocytes can morph into skin cancer and cause melanomas. We know that. But it's an interesting thing what they do. The key to the awakening process is a gene called SLUG. So melanocytes come out of the brain and travel to around the body in the embryo, and they find out where they're supposed to be, which is usually in the skin. And these melanocytes begin in the midbrain of the developing embryo and migrate to distant sites throughout the body, including the skin. The SLUG gene is permanently turned off once the melanocyte arrives at its destination. When melanocytes become malignant, they reactivate the SLUG gene, turning it back on. This gives the cell an immediate ability to spread, especially to the brain. It wants to go home. It's kind of a homing instinct. So melanomas are particularly bad about migrating or metastasizing back to the brain, and that's the reason. And the reason people with type 1 skin don't tan is that melanocytes in their skin are unable to produce protective melanin pigment, which may be a good reason for really fair-skinned people to take it easy on the sun. If you don't tan, you're probably not going to be protected from the sun's rays. And obese people are a lot less likely to have adequate levels of vitamin D. They need 3 times more vitamin D a day than a normal weight for people do, because the vitamin D gets, again, it's in the fat cells, it's where it's stored, and it can't get out. So even though it's there, it's not accessible. When the diet lacks calcium, there's an increase in fatty acid synthetase, an enzyme that converts calories into fat. Higher levels of calcium with adequate vitamin D inhibits the enzyme, which, while diets low in calcium, increase the enzyme. So if you have a diet low in calcium and vitamin D, you're more likely to store or save fat cells than it would be if you had the proper amount of vitamin D and calcium. The presence of calcium and vitamin D in the body turns down the volume of this fat-storing enzyme. Without adequate calcium and vitamin D available in the body, turns up the volume of the fat-storing enzyme. Now, radical weight loss can also speed bone turnover, causing the breakdown of old bone to outpace the formation of new bone. Patients who've had a gastric bypass also have 5 times as much vitamin D, or take up to 5 times as much vitamin D as a normal person, because their absorption is much more reduced than someone that has a normal gut and normal flora. Over-the-counter and prescription drug alert. Medications and even some over-the-counter herbal medicines can interfere with the body's ability to maintain levels of levels of 25 vitamin D. That is the vitamin D that comes out of the liver. Anti-seizure medications, people need 2 to 3 times. These are people who are epileptic, are going to need 2 or 3 times the amount of vitamin D as a normal person. Prednisone is another one that interferes with the levels of vitamin D. Immune therapy drugs, somebody's had a transplant is going to need more vitamin D than someone else. St. John's wort, again, going back to the over-counter remedies, is something that interferes with the absorption. I mentioned obesity, and some of these cholesterol-lowering drugs would also interfere with vitamin D absorption. But some other reasons is bad people who can't absorb fat. Vitamin D is a fat-soluble vitamin, so you're going to be less likely to absorb it. Crohn's disease, because you have an irritated gut, you're also not going to absorb your nutrients as you should. Kidney failure, vitamin D-dependent rickets. There's 3 types. Type 1 affects the body's ability to convert 25 vitamin D to its active form, which is 125 vitamin D. Type 2 interferes with the body's ability to recognize 125 vitamin D, again the active form. And type 3 makes too much of a protein that prevents vitamin D from working. So I just thought there was one, rickets was rickets, but there's 3 different reasons why it would work, why it won't work correctly. And celiac disease, which we're hearing a whole lot about now, I don't think it's a new disease. It's probably just being properly diagnosed. I've got several friends with it. A lot of us have probably a small portion of celiac and don't realize it. But these are the people who need to avoid wheat, oats, barley, and the grains. But they have a problem with absorbing fats also, so they're going to be less levels of vitamin D. And people with eating disorders, anorexia, something like that, someone who does not maintain the food levels, it goes down and comes back up. Liver failure, cirrhosis, or cystic fibrosis would be another area where people are going to need extra vitamin D. The solution, estimate how long. This is the sensible sun exposure part. Again, I'm not a dermatologist, but this is what's being suggested. What you want to do is you want to get in the sun a day like today, which is a little hotter than our normal North Carolina day, depending on the time of year also. So this is a bit variable. But what you want to do is extend your arms and your legs, put a bathing suit on, but you want to get enough sun exposure so that you turn slightly pink 24 hours later, not slightly pink. So that's not burnt, that's not uncomfortable, that's not itching, that's not laying around with wet towels on you. It's like, you remember anybody as a kid do that? You go to the beach and you couldn't ride home in the car because your back was so burnt. That's not what we want to get to. You want a little bit of sunburn, a little bit of pink. And then what you do is you can do 25% of that amount of time that gets you there. So this is a little bit of titrating. It's a whole lot easier to take supplements, but what this is going to do is build up your melanin so that you are protected from the sun, and at the same time give you the natural vitamin D that, again, will last 2 or 3 times longer than the supplemented variety. And very difficult to get enough vitamin D in our foods because you don't eat enough mushrooms and you don't eat enough fatty fish. I mean, you can eat a lot of fortified milk, but you can't get enough vitamin D that way, and the amount of fortification is really pretty low. So after getting that amount of sunlight that you figured out, you go ahead and expose yourself for the 15 or 20 minutes. I guess expose your arms and your legs. I got to back up on that expose yourself. Sharon knows the way I think. So after you get that amount of sunlight, then go ahead and put your block on. So you don't want to continue to expose yourself and burn, but you do want to get enough to activate your own natural vitamin D process. And bone up on calcium. Calcium is the most abundant mineral in the body. Over 99% is present, being found in the bones and teeth. It's also well recognized that vitamin D aids in the absorption of calcium as well as phosphate. 25 vitamin D, the active form of vitamin D that we reclassified it as a hormone that controls calcium metabolism. Hormones, again, derived from the Greek word meaning to stir things up, and the vitamin was vitamin. 125 vitamin D is produced by the kidneys into the bloodstream where it can be traveled to the small intestine. We mentioned that leads to the buildup of some cell nuclei of the intestine where it regulates the efficiency of the absorption of dietary calcium. And now this is what I really want to talk about, bisphosphonates, because what we're talking about is a general health concern with vitamin D and our lack of it. But in dentistry, I'm seeing more and more of these lesions coming up from this bisphosphonate drugs, and some of the brands, Beniva, Zometa, Actinol, Reclast is an injectable form that's given once a year. But this is destroying these bones, and we're seeing these lesions that you can't cover this up. You can't cut that out. The more you whittle on that bone, the worse it gets. The surgeons don't know what the heck to do with these things. And these people are pretty miserable. So what you've got there is dead necrotic bone. You can see the radiograph that shows how extensive this is. And, I mean, this person is not far away from a total fracture. Once that jaw fractures, there's no healing this. You can't put this necrotic bone back together. And this is being caused by these bisphosphonate drugs. And again, what the bisphosphonates do is they stop the osteoclastic activity and also decreases the blood supply to the bone. So what you're doing is you've got bone osteoblast working to make osteocytes, but you don't have anything getting rid of the old bone. So you're constantly making bone, and what it's doing is growing out of the tissue without a blood supply. Not good. And here's some more pictures of lesions that occur in the mouth. You can see this is the same type of lesion I showed you a minute ago. And then we've got one down here. And these often occur with extraction sites. I've got patients who have dentures who have developed these. I've seen them just spontaneously erupt. You send them to the oral surgeon, and they don't quite know what to do with these. But what we're doing now, we're injecting ozone in and around these areas. We're going ahead, if this is the posterior ramus area, we're going ahead injecting ozone up in here with the hopes of rebuilding this bone. Now, the ozone is going to increase blood flow, and it's going to increase drainage, and it's going to change the polarity of this area. We're also going down in here and injecting some procaine, vitamin B12, and folic acid, using electric stimulus to change the electrical conductivity from a positive to a negative, so we increase blood flow into these areas. But still, I mean, if these would be, my theory is these could be prevented if, in fact, we had vitamin D levels that we should, because you wouldn't be taking the bisphosphonate drugs. Now, time will tell if that's true, but the studies are coming out now that's suggesting that people shouldn't be on these drugs for longer than 3 years. It used to be that they would put them on women particularly. I might have one man in my practice on the bisphosphonates, but generally it's women because they're more prone to osteoporosis than men are. Perhaps because of testosterone connection, I'm not sure. But the bottom line here in the conclusion is that we have sensible ways to get vitamin D. Supplementation is by far and away the simplest. I would highly suggest you get with your physician, get checked. My suggestions of 50 or 5 to 10,000 units a day are kind of subjective. That's what I'm taking, but it's really determined by your physician. Once your vitamin D level gets to where it should be, then you can adjust your levels however you want to. Vitamin D is very easy to acquire. Any health food store and any drugstore really has it. And, of course, you can supplement also with calcium. So that's what I would suggest you do, and I appreciate you all being here. Thanks. I don't know that it matters. I take the capsules because it's just a lot easier to take. The little tiny rascals usually comes in 1,000, 5,000 units per capsule, and I just take 2 of them a day. And the nice thing about vitamin D is you don't have to take it every day. If you wanted to take it once a week and just take 10 of that amount, you can do that because it's fat stored. So if you want to take it every day, you can, but it's not absolutely necessary. Because, again, we're naturally designed for the sun to make this, and that's a summer exposure, and we're supposed to go all winter long with that vitamin D stored. No, just swallow it, absorb in the gut. Yeah. Yeah. Well, thank you.